45-year-old collapses at work. No chest pain, just confusion. One 30-second test decides if he walks out of the hospital or never speaks again. Let me show you how a simple test can literally save your life. In this video, I'll show you 5 simple tests we use in emergency medicine that anyone can understand. These aren't advanced procedures. They're things you, your family, or first responders can do or ask for that change outcomes. If you work in healthcare, are a student, or just don't want to miss the signs on someone you love, watch this all the way through. Our first story, a 60-year-old patient with a mild facial droop who felt off. His family almost sent him to bed, but one fast check changed everything. FAST stands for face, arms, speech, and time. Let's break it down. First, check their face. Ask them to smile. Does one side droop or look asymmetrical? Next, arms. Ask them to raise both arms. Does one arm drift downwards? Then speech. Is their speech slurred or do they struggle to find words, creating a word salad? Finally, time. If you see any of these signs, call EMS immediately. Time is brain. Recognizing fast within minutes can be the difference between walking out and permanent paralysis. Share this part with your parents. It could truly save a life. High blood pressure is called the silent killer for a reason. Below 90/60 in the wrong context? Think shock. Symptoms include dizziness, fainting, and confusion. Above 180/120 with symptoms? We treat that as an emergency with severe headache or blurred vision. We get a patient with a headache and blurred vision. BP is 220/130. That number tells us we're in organ damage territory. If you own a home BP cuff, don't just track the number. Know when it means go to the ER now. Next, let's talk about pulse oximetry or SpO2. 95 to 100% is generally fine. But when we see below 90%, that's a red flag. At low 80s, we're in why is this person not ventilated yet mode. Consider a patient who is just a bit short of breath, but their oxygen saturation is 84%. This number tells us your organs aren't getting enough oxygen before you look obviously blue. A normal reading is between 95% and 100%. Seek immediate medical attention if the level falls to 88% or lower. Now, blood glucose. This is crucial, especially for diabetics. Below 70 milligrams per deciliter, your brain is starving. Symptoms include shakiness, sweating, and confusion. Above 300 milligrams per deciliter with symptoms, think diabetic emergency with increased thirst and blurred vision. We once had a confused, sweaty patient brought in as psychiatric. Their sugar was 32. 1 finger stick and 4 dextrose later, they were back to normal. If someone is acting off and is diabetic, checking sugar before assuming drugs or behavior can literally save their brain. Finally, let's discuss heart rate. Resting 60 to 100 beats per minute is typical, but 140 or higher at rest in a sick patient, or 40 and they're dizzy. We take that very seriously. Tachycardia symptoms include palpitations and chest pain. Bradycardia symptoms include dizziness, fainting, and confusion. We see a pale, sweaty 30-year-old, HR 150. That pushes us to think bleeding, pee, arrhythmia, and we move fast. So, fast for stroke, blood pressure, pulse ox, blood sugar, heart rate, 5 simple checks that guide almost every life or death decision we make in the ER. If even one person recognizes these signs earlier because of this video, that's a life saved. Send this to your family group chat. If you want more real emergency cases broken down simply, hit subscribe. We do this every week.